Now we will study the demonstration of bony pelvis. It is a ring of bone. It consists of two hip bones, sacrum and the coccyx, which articulates at these four joints: sacroiliac joint, sacrococcygeal joint, and this is the pubic symphysis. This bony pelvis, it is divided into the two parts: greater or false pelvis above, and this is the true and lesser pelvis below by this pelvic brim or pelvic inlet. Boundaries of pelvic inlet, it is from posterior to anterior. Posteriorly sacral promontory. This is linea terminalis and this is the pubic crest. This linea terminalis, it consists of anterior border of ala of sacrum. This is the arcuate line or the lower part of medial border of ilium, pecten pubis. So whole it forms this linea terminalis and this is the pubic crest. So this pelvic brim, it divides this bony pelvis into greater or the false pelvis above and true and lesser pelvis below this pelvic brim. We are concerned with this true pelvis. This true pelvis, it is a cavity. It has, this is the inlet, this is the cavity, and below this is the outlet. We have studied the boundaries of this pelvic inlet, and it has three diameters, that is the anteroposterior diameter from this upper surface of pubic symphysis to sacral promontory. Then it has transverse diameter and this oblique diameter. At this pelvic inlet, the transverse diameter, it is the widest diameter and it is about 13 centimeter. This anteroposterior diameter, it is also called as the true conjugate, and we can calculate this diagonal conjugate by per vaginally, and we can calculate this true conjugate from the diagonal conjugate by subtracting 1.5 to 2 centimeter. Then this is the pelvic cavity, which has all the three diameters equal. It is about 12 centimeter. Now we will study this pelvic outlet. So it is a diamond shaped inferior aperture of this pelvic cavity, which is bounded anteriorly by this inferior surface of pubic symphysis. Then this is the inferior ramus of this pubis, istiopubic rami. Then this is the ischial tuberosity. Here is the sacrotuberous ligament. So this is the position of sacrotuberous ligament and this coccyx. So this is the pelvic outlet. It is a diamond shaped aperture. It has again anteroposterior diameter, transverse diameter and oblique diameter. Anteroposterior diameter, it is the widest diameter of this pelvic outlet. It is about 13 centimeter, and this transverse, it is also called as the interischial diameter. It is the smallest diameter of this pelvic outlet. This pelvic outlet, it is covered by pelvic diaphragm, which consists of this levator ani muscle and the coccygeus muscle. Now we will study the anatomical position and the difference between male and female pelvis. Anatomical, to hold this pelvis in this anatomical position, this anterior superior iliac spine and this pubic symphysis, it should be in the same coronal plane. We can show it by touching this anterior superior iliac spine and this pubic symphysis against a wall. So this is the anatomical position of this bony pelvis, in which this pelvic surface of this pubic symphysis, it is directed upwards and backwards. Then this, you see this axis of pelvic inlet, it is directed upwards and forwards, and this sacral canal, it is directed vertically upward. So this is the anatomical position of this pelvic bony pelvis.